Folks, we're back. I'm your host, BKP. We're at Circuit World here in Blue Ridge, Georgia. A little cold morning, but beautiful.
This is my kind of morning, I tell you. I call this fireplace weather.
Fireplace weather. We're now joined by Dr. William Whaley from the Georgia Cancer Research Center, affiliated with Northside Hospital. We appreciate them. Dr. Whaley, how are you?
I'm great, and yourself?
Good. You're wearing somebody's jacket. It says Bill.
Oh, this is my, you know, I wear that.
I'm looking over. I'm like, who's Bill?
I wear that military jacket all the time. This is a Randy Travis tour jacket from the '80s.
Wow. Okay. All right. Always something. That's one of the reasons you got to tune in with Dr. William Whaley. There's always something. Randy Travis tour jacket.
Yeah. Here.
All right. Let's see. Randy Travis. Wow. USA Europe 1987-88. Took us back.
Antique,
you
huh?
took us back a little bit, but we'll go with it.
Right.
How are you today?
Fine. Yeah, no, he was a very close friend, and we toured with him quite a bit in those days. So anyway, I got several of these of different tours. That blue jean jacket I wear sometimes is a Travis jacket. And then I've got a big one that looks like a ski jacket. And they gave you one of these every year for the tour.
Could you ever sit and tell me any Waylon Jennings, Willie Nelson stories?
I did indeed, yeah. I haven't told you any Randy Travis stories.
I was going to say.
Well, listen, I got to tell you, I'm tired. I flew down to Miami Wednesday night, and I was in court all day yesterday. And 2 or 3 times, once in the airport in Atlanta and once in the airport down in Miami, there were people wearing Atlanta United soccer shirts.
Yes.
And I was talking about this television over here, because when you were sitting here talking about the television, the biggest thing to happen in North American soccer is going to happen tomorrow. And we're kind of out on a limb up here. I think we're not part of the move, but the city of Atlanta is soccer crazy today. Last night at the airport, there are people piling in from all over wearing Atlanta United and Portland, whatever it is, shirts. It's like not quite as big as the Alabama-Georgia football game down there, but it's a big deal. And we have soccer up here. We have our kids up here go off and play college soccer, but we don't seem to focus as much attention on talking about that as we do about local football and local baseball. So we're a few years behind the metropolitan area, but there's going to be a huge soccer game tomorrow, and it's going to be on TV, and people up here probably ought to watch it just so they can know what they're talking about.
I've not been involved in that much soccer conversation probably in 18 years.
Okay, have y'all broadcast any local soccer games of our team here or not?
No.
And you haven't gone on the field like I saw you down in Pickens County interviewing the coach or anything?
No.
I just wondered, maybe I'm just trying. All I'm trying to say is there may be another layer on the onion of sport up here.
I do agree with you. I do agree with you. I do agree.
And I know that we have good soccer teams up here. I know these kids. Some of the girls actually have gone on to play.
Absolutely, you're 100%.
So anyway, when we were talking about the TV, I got to thinking that everybody else tomorrow. There's not football. There's a big football game. Army Navy tomorrow.
Yes.
Yeah, that's a great football game because of the like Bob Dole and George Bush. But if you really want to watch a contest, it's that one right there. Tell about George Bush. When I read the book Flag of Our Fathers, remember that book?
I did not read it. I remember the book.
Oh my God, you got to read it. That guy's written some great books. But in that book, just as an incidental finding, you remember that George Bush was on a mission to bomb not Iwo Jima, but Miyajima, which is an island right next to Iwo Jima when he got shot down. You remember the story when he got shot down?
I do. Yeah, I do remember the story.
He got shot down right in the middle of Japanese waters. Japanese were on all of the islands.
But he completed the mission when he got hit.
You did. But here's the next point. When he went down, he thought that he was going to die because he was in the middle of Japanese waters where they were shooting. They just shoot you. and he was next to Japanese land. If he put that plane down on land, it would have been on Iwo Jima or Jimimimi or whatever it was, which is a Japanese-controlled island. So he went boom down into the water, and he plops down and he gets out of his gets out of his little airplane, and getting out of the airplane is a pretty good thing. And up pops a U.S. submarine. Just happened to be in the area. Otherwise, he'd have been dead at age 20. And you realize that he was the youngest fighter pilot in the U.S. Navy.
Yes, I do realize that.
He kind of manipulated the system at age 17 to get started. But he was the youngest fighter pilot in the U.S. Navy. Now, my daughter thinks he's part of the conspiracy and all. My wife does, the conspiracy. But I think the guy was a World War II hero, and that's the guy who got buried, was the World War II hero.
Can I ask you briefly before, and I want this from you, briefly before we go into the questions, and I've been waiting to get you here all week on this. Can you sum up in a couple words your feelings, or put your feelings out on what it meant when you saw Bob Dole do that salute? Can you give me that?
The death of a generation. That's the end. That is basically the end of the greatest generation in American politics. Now, there are going to be some that don't live to 100 that are off on a farm somewhere, but that's the last two personalities that we have. And I was brought to tears by it. You know how Dole spent, what, 2.5 years in hospitals?
Yes. He held a pen. Most people don't know. Is it his right hand? Yeah. He held a pen in his right hand his entire adult life, so something would be there because he couldn't.
Yeah, 2.5 years in and out of the hospital. That hand was. I mean, it's. If you read about those guys, they were teenagers at the time, and then you can not agree with their politics. I mean, you know, once you get beyond that point, they've done lots of stuff. My wife says, "Yeah, you realize that Bush didn't go to Yale till after the war."
Right.
And yes, he was in Skull and Bones, or whatever my wife thinks is the etiology of the conspiracy theory. But anyway, two teenagers at the end of their life were there. And
you're never going to convince me that you're telling 18 and 20-year-old kids that they need to go and report so that they can defend their country or defend freedom abroad, that have any other thought other than I'm supposed to go defend freedom. Now, what happened later, you can debate that.
Yeah.
But on that day when you had 18 and 20-year-old kids, you know, that's where we're at.
I just finished Desperate Ground, which is the book about the Chosin Reservoir retreat, and I'm almost through with Red Platoon, which was written by Clint Robichaux, about the battles at Cop Keating in Afghanistan. So we have sort of neglected the fact that those guys are still there, and that's the guys we have now in smaller number. But we just lost 2 special operators last week from in Afghanistan, where we don't have any combat going on. And my nurse's son is an A-10 pilot in Afghanistan today. I was in contact with yesterday, and they're flying combat missions 7 and 8 hours a day. So we don't have the draft, so that everybody out there doesn't have a cousin or something that's in the military, and there's this big volunteer military. But you look at these guys that were killed the other day, they are 4th generation military. So we've sort of come up, like in London, you have cab drivers who have had the same medallion since the days of horses and buggies. It gets passed down to grandson and grandson and grandson, so they can have that medallion, and they were raised to be cab drivers. We're raising a military group of people now that tend to be people from the same family that are in their 3rd and 4th generation, which is why I'd like to go back to a draft and let everybody have a chance. You want to talk about cancer here?
Okay, our first question. Again, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital.
No big
words. The segment. No big words today. Exactly. How accurate are diagnostic tests for lung cancer?
Well, that's a really good question, because we had a couple of weeks ago, I was talking about the people who get cured of pancreatic cancer because it's found when somebody's doing an ultrasound for a kidney stone or a gallstone, and they find a pancreatic cancer mass that's small and young long before it would have caused symptoms. Can you show that first picture, please, Josh? The first picture that we're looking at here is a picture of a very small cancer of the lung, stage 1. That tumor is so small that it would not cause any symptoms. The patient would not have any cough. He would not be short of breath. Now the second one's going to be big enough to perhaps, but this is the one, you want to find this cancer when it's in its tiny stage, stage 1 cancer. Now the question is, how accurate are the tests? So show that big old complicated chart over there, Josh. This is the National Cancer Guidelines for lung cancer screening, and if you look, they've got people divided into 3 categories in terms of risk. And high risk, who would be subjected to the screening test we're going to talk to in a little while, are people who are over the age of 50 up to 74. The reason they stop at 74 is they think that at 74 you're beyond saving. Who have smoked greater than 30 package years. Now that could be 2 packs a day for 15 years or a half a pack a day for 60, and that they have discontinued smoking less than 15 years ago. Well, that's a huge number of people in it, because we have so many people that have given up cigarettes, that give them up in their 30s or so, that have at least 30 pack years. Now there's a few more things in there and we don't need to worry about it, but that would be the group of people that they are asking the question about. And then when they talk about how should you screen them, the question just says diagnostic tests. At the present time, there is only one diagnostic test for lung cancer that has any scientific, experimental, peer-reviewed data to show that it's worth doing, and that is that low-dose CT scan. You got it? So number one, you don't just go out and pick everybody out here who smoked for 5 years or 10 years. You got to get into that high-risk group, number one, so that your insurance company will pay for it. But below that, there are more hazards in doing the exam than there are benefits. And you're going to say, wait a minute, what do you mean? Well, let's go to the next one first. I said you have to be in that high-risk group before somebody will pay for it. Now this third one here, Josh, where it says guidelines, if you look at that, 1, 2, 3, 4, 5, 6, there's 7 different groups in there, from the American Cancer Society to the Canadian Task Force to the American College of Chest Physicians. Out here on the right-hand side is the years, but basically every one of those recommendations are different about who ought to be scanned. It's kind of like the deal where you can pull that one off, Josh, and leave it blank a minute. It's kind of like that deal where to a hammer everything's a nail. So the mammogram guy tells you you need to start, you need to do mammograms at this frequency, and Medicare says we're not going to pay for it at that frequency. It's sort of like the PSA where Medicare says we're going to stop paying for it at 65, so that doctors don't get the opportunity to say, I want BKP to get this study because the American Cancer Society said it was worth doing, and the insurance company will say yes, but it doesn't meet that first NCCN guideline I showed you. So anyhow, if you meet those high-risk categories, there are all those different folks. So now we're going to order a low-dose CT. All right, now put that next one up here. The reason I said you don't want to do that study on people who don't meet the criteria is, if you look at, here you go, there's 17,000 studies done on patients, so this 17,600 is 18,000. So out of 18,000 people screened, only 600 had lung cancer, okay? So this group over here of 18,000 who did not have cancer, who had something abnormal on the scan, there were a group of what, 100, 300, so about 400 of these people here went in, had a spot on their lung that they either operated on and took out, did a bronchoscopy where they go down in here and stuck a needle biopsy in there. They did not find cancer, but you get over here in the right-hand side, it killed people. They died. You look over here about intermediate complications. That meant their lung collapsed. They ended up in a hospital with a tube in their chest. Major complications meant they bled like terrible. They had to operate on them and take something out. So there's nothing benign about the screening procedure. And so you have to encourage people. One, you got to get in a high-risk group to do it. If there's something there that looks malignant and you're going to have to go after it, you got to recommend that you got to remember there's sort of a downside. So what I'm coming to at the end is I am discouraging you from responding to that ad in the newspaper that says for $125 you can come in and get a total body scan and look for cancer and heart arteries for $125, where hey, people just walk in off the street and get that total body scan, because at the end of the day, more things are found and intervened upon in the fashion that I've outlined here than are statistically valid in terms of saving your life. Does that make sense?
Yes.
So I think you told me you were growing up around the country up there in New Jersey or somewhere, right?
Go ahead.
Okay, so I mean, what I'm going to say, at some point, you probably inhaled some chicken manure, or you've been out camping in the woods or something. So it would not be unusual were you to have a scan, for you to have some spot on your lung that says ill-defined nodule in the lung, you know, blah, blah, blah. And if you went for one of those $125 scans, then you'd go panic and you'd go see somebody and they do something, you could get in trouble. Now, if you'd smoked for 30-pack years and had other, you know, worked in an asbestos mine or something, then it would be worth going after that thing. Did that make sense?
Yes, it did.
Good. All right. So
yeah,
I will say one.
But I do have a quick question. Explain pack years. You did earlier.
Oh, pack years. Okay, that's just a multiple.
Yeah, I know.
Okay, 1 pack a year for 30 years is 30 pack years. Half a pack of cigarettes for 60 years is 30 pack years. Or 2 packs a day for 15 years is 30 pack years.
Okay, got it.
Okay, now, one more thing I was going to say about that. And the question was, how accurate are the diagnostic tests? So at the end of the day, the diagnostic test is accurate at 92%, actually, what it said. If you have done it to the proper patients with high risk, and if you have followed a pretty rigid protocol of evaluation. But if you're talking about going into the doctor and just saying, give me a chest x-ray, totally inaccurate, it's not, you shouldn't do it. And any other thing, they say, oh, like you can cough in a cup and we'll find cancer cells in your sputum. They used to do that. That doesn't work. If the test, it says diagnostic test, like they're multiple. So we're throwing out chest x-ray, we're throwing out coughing in a cup, and when we get to the news of the day, we're going to come back to another screening test in a little while for all kinds of cancer. So if you do it with the right risk group, if you do it with the proper protocol, they're accurate tests. Is that pretty good?
Yes, thank you very much. And again, thank you, Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Our second question of the day, for men with low T, okay?
Yeah.
And actually, my computer just went dead because my battery's down. So men with low T is all I got on my computer. Men with low T, what is the best practice to maintain good levels?
Okay, so first thing, it's acting like we're not going to be taking testosterone replacement therapy, which I'll come back to in a minute. Is there a practice to maintain the level when the level is lower alcohol? Yes. And then there are not any lifestyle changes there are not any dietary changes that'll maintain a normal level. There are 2 or 3 things about this that are important. One, you're treating human beings and not laboratory tests. You've heard me say that many times. We treat a human being and not a lab report. So a blood test that says your testosterone is at the low end of the range is not an indication to go take DHEA or men's thing off the television or go ask your doctor about taking testosterone cream or shots. If a patient, let's take a man in his 50s, is having fatigue, loss of sexual interest, and Josh, show that picture up there. It's got a dozen things on it, but the idea is, if you think of Barry Bonds took testosterone, put on only 20 pounds, and then broke a bunch of home run records. And people think, boy, that really made him Superman or the Mighty Hulk. Maybe I need to take more testosterone. Well, ask our baseball fan over there, how much additional length on the average hit did Barry Bonds or McGuire or Sosa, 3 guys we know that admitted to taking testosterone, get on their long hits to increase their number of home runs? How many feet did that ball go farther? Give me an answer. Pull it out of your head. Give me an answer. What do you think?
What you got?
22? Okay, we got 1 for 22. 15.
30.
5.5 feet. So you think about all those balls that go up, the guy can jump up and catch or hit the top of the rail. They got 5.5 feet, which just got those balls over the top of the rail. So this testosterone, even in overdose, high dose that's not physiologic, doesn't make you Superman. If there is a low testosterone condition that is causing fatigue, loss of muscle mass, low blood pressure, fainting when you stand, inability to tolerate being in the heat and all that, you got to go to Dr. Tidman and get a diagnosis. You've got to get appropriate treatment, and going to the health food store and getting DHEA or men's supplement tea or anything else is not the proper way to take care of it. Is that good enough?
Yeah, there is a lot of stuff on TV to promote that.
Yeah, right.
And really, if you're dealing with the symptoms that you described this morning, you recommend immediately going up.
Go see your doctor.
Go see your doctor.
And you don't know where that stuff's been made, do you? It's all we went back to where the China thing is. As a matter of fact, yesterday, the government pulled off another whole class of medications. It's not important because, in fact, what was it? Remember, Josh? It wasn't that blood pressure medicine. But anyway, it's another one they pulled off the market yesterday. Lots of people take, and it's branded. It's got U.S. brands on it. It's not something that people are getting from Canada. Most of our medicines today are actually made in India or China or Singapore or somewhere for U.S. companies, by U.S. companies, and are stamped with U.S. U.S. Says Bayer on one side, got a number on the other. But you really don't know where that stuff you're buying off the television or buying off even worse off the internet, or even worse than that in the gym, came from, or what it's got in it. So go see a doctor, and don't take a shot because some guy at the health club who's got muscles all over him tells you if you take this shot every 2 weeks, it'll keep your testosterone up.
Thank you.
You're okay. Good.
I'm trying to pass by. You brought up Mark McGuire and no, I wouldn't say Barry Bonds. Oh,
well, I got to tell you an interesting story. Back in the days of this, Randy was a friend of the, excuse me, Mike Tyson was a friend of the trainer for the Oakland Athletics. And we were on tour with Randy in San Francisco. And Mike Tyson, Randy and I went to a game, like Jane was there too, went to a game and were the guests of the coach and the trainer, whose name was Barry Weinberg. And McGuire and Piazza were rookies. And they were just pounding the cover off the ball. And Barry took us to the locker room, and he was the first guy in baseball to work out a ball player before a game with weights. It had always been before that baseball players, it was said, don't lift weights for a full day because you're going to be fatigued. Right. You can't hit. So he had this different concept. What we didn't realize at the time was that his concept also included shooting them in the fanny with testosterone. And so our friend, in fact, in my house, I've got Barry Weinberg's Oakland Athletic hat from that night and that day. I brought it back. It says Weinberg on the inside. No, it says Barry on the inside of the bill. But I guess I watched standing there the steroid abuse in baseball get started by Barry Weinberg. That's
so we
another
fly
one of those Andy Travis stories. Huh?
We go to San Francisco on vacation. Really quick story, and we take the bus tour. You know, because we're going to take a bus tour, and you got the bus driver, and bus driver has all the knowledge of the streets of San Francisco. So we get on the bus, and so our first stop down in the morning from the hotel, we're staying up on Nob Hill. Is that what it's called?
Right. So the big old fireman statue there. Yeah.
Right. So we're up on Nob Hill. We get on the bus. Our first stop is, what is the San Francisco's Giants Park? Safeco Park? Is that it? And we go down to the park, right? And at that time, Barry Bonds is hitting these home runs, okay? And there's a big banner on the park that says Barry Bonds and has the number of home runs, and they change it every time you hit a home run. And it's an enormous banner on the park, right? And right in front of it is an awesome statue of Hank Aaron. I mean, Hank Aaron. And I wanted a picture of Hank Aaron. And everywhere I went to get the picture of Hank Aaron, Barry Bonds is in the... So I actually looked at the bus driver, okay? And I said, is there anywhere you can get a picture of Hank Aaron without Barry Bonds in the back of it? And he looked at me and said, what's wrong with that? From that point on, Lisa accuses me from that point on that he never answered another one of her questions throughout the day on the tour.
Probably true.
That's
probably true.
It's because of you. Everything I asked him about San Francisco, he never answered. So I couldn't help.
It's time for you to go back.
Yeah, exactly. Okay, sorry about those little stories, but hey, I enjoy this so much. Again, thank you, Georgia Cancer Specialist of affiliate with Northside Hospital, for this segment. Okay, so what is going on in the medical field, in history, what's happening?
Okay, two quick things. One, the paralysis epidemic that we've been talking about that we don't understand is just beginning to fall off as we predicted it did. That was announced by the CDC yesterday. But yesterday there was reports from a group in Queensland, Australia, where there's a really great university. We have talked here before about this blood tests to diagnose cancer, and I've said many times that there are tests in the works that you'll be seeing more commonly here in the next few years. We call them liquid biopsies. And we have specific liquid biopsies when we're following lung cancer or we're following ovarian cancer, where they can find DNA to that specific cancer in a blood test. And this is still experimental. It's nowhere near ready for prime time. But the people in Queensland, Australia, yesterday released a very preliminary report that they have developed a blood test that doesn't go for the specific DNA of the cancer that you've got we're trying to follow, but picks up most cancers, so that it's really actually getting to the point of where there's a screening test that if it comes true, would probably be able to pick up the most common cancers that we have. They said in the note it was ovarian, colon, lung. Well, I mean, that's ovarian, colon, ovarian, colon, and lung, and perhaps prostate. Man, you get that and you got a lot of cancer. So keep your eyes out for the continuing research on a test to try and find fragments that say cancer in general, not cancer in specific in your blood. And if we get that, we're going to really make a big click. I'll be way gone by the time that happens. You'll still be here.
I'll still be here. I'm looking forward to that. Anything else?
No, that'll get. We talked about.
We got to get you to work.
We talked about politics, yeah.
Yeah, we got to get you to work. We know you been down to Miami and back, but we have some weather advisories for the weekend.
Ain't that wonderful? We'll have a fire in the fireplace, and cook some bean soup and watch soccer on television.
Is there something medical about needing the milk and bread? I mean, can you break that to us now? Why we have? Is there something that triggers that we have to have the milk and bread?
I think you need pinto beans. You eat pinto beans and have a big old pot. Anytime there's bad weather, I always cook beans. Don't ask me why, because that's a survival food, I'm sure.
I like that. Hey, this has been Ask the Doc with Dr. William Whaley. And again, we thank the Georgia Cancer Specialist, North Georgia Cancer Specialist affiliated with Northside Hospital. If you have a question for Dr. Whaley, don't forget you could send that to info at fetchernews.com. Put in the subject line Ask the Doc and send us a question for Dr. Whaley. We'll get it over to him, and hopefully every Friday, sooner or later, we'll get your question answered here. And if not, he will get back to you. That's a promise. Everybody that sends a question, Dr. Whaley does respond. So please don't hesitate to send that question. And let's see, I've got an all-star political panel ready to go, and I'm for sure they
barely.
Huh?
Barely got it ready to go.
Boy, you're just you push to get in trouble. I don't know what it is with you.
I know. And
I said for it.
And I said
we almost got you out of here.
Bush was a hero. Bush was a hero because he was flying at age 17 and was the youngest pilot in the Navy and went down in Japanese waters and thought he was going to die.
We almost get you out of here without you getting in trouble, but no, you just can't do it, can you? Dr. Whaley, appreciate it. Now, on the other side of these messages will be the All-Star Political Panel, and we'll be right back.